In the name of God, most gracious, most merciful, we would like to welcome our speakers in this press conference for the National Taskforce for Combating Coronavirus, COVID-19, Dr. Walid Al-Mana, Minister of Health, Undersecretary, and Lieutenant Colonel Dr. Manaf Al-Qahtani, Infectious Disease Consultant at the BDF Hospital, member of the National Task Force for Combating Coronavirus, and Dr. Jamila Salman, Infectious and Internal Disease Consultant at Salmania Medical Complex. And we would like to note that this press conference is going live on the YouTube channel of the Ministry of Health in 5 different languages. And we have also the journalists and reporters joining us remotely. Now we start with the Minister of Health, Undersecretary. In the name of God, most gracious, most merciful, we praise the Lord, and may God's peace and mercy be upon our Prophet. Ladies and gentlemen, thank you for joining us in this press conference. First, we highly appreciate His Majesty, God protect him, for his appreciation to the medical team. His Majesty the King has taken the hearts of a loyalty of all, and we praise him and we pray God that he would protect him. So the efforts of the Ministry of Health would be integrated with all the bodies in the Kingdom of Bahrain to combat COVID-19 with great determination. And there is clear methodology that we always emphasize on to trace, to test, treat, and trace. So we emphasize on this triple T that we shall follow this methodology in the Kingdom of Bahrain, and we are proud of it, that we have the capacity, especially for conducting tests. So we also have there is something for the Ministry of Health in coordination with there is disconnection. For labor dormitories, there were strict procedures to conduct tests through the mobile testing units. They've taken the laborers to the test centers. Also, there are awareness campaigns. At the same time, these campaigns are proactive, that contributed greatly to identifying the cases and deal with them accordingly, either to send them into isolation centers or treatment or the quarantine for the interest of their health and the health of the community in general. Of course, we have increased the number of tests on a daily basis, and we have found an increase in the number of the active cases. Among the reasons for this clear increase in the cases is because they are gathering populated in one place That's why we emphasize on implementing the distancing steps and methodologies for citizens and residents, and we shall strictly do that for the health and safety of everyone. In addition to social distancing, we also emphasize on the precautionary measures, which is the continuity of washing hands and to use sanitizers and to clean the surfaces and sanitize them on a periodic manner. And we have some disinfection operations doing by the civil defense. These are simple procedures but of great impact. So, to avoid touching any person who have fever, all of these are examples of important measures that, also would avoid the gatherings as well. Also, if there are any symptoms, we shall call the 444 and follow the instructions. And we emphasize on the protective equipment. And I think we also emphasize on the masks made at home, because all of these would have an impact. They are instructed to protect you and protect the persons you contact with when you wear them. So the two sides would benefit if everyone is following these instructions. If you wear the masks, well, as for the first case, we have the total tests are 65,768, and there is an increase because now the positive cases, 2% of the total tests, so 90% were negative, and generally that shows the large number of tests we're doing. So if we have 100 individuals and one of them is positive, then we would track the remaining numbers who had contact with this 1% in order to ensure their safety and health. And at the same time, we have mobile units going to different areas doing random tests, though according to certain calculation, to check the people. Just to give you an example, in Bahrain, this huge number of tests, in order as much as possible to identify the cases and put them into quarantine. So maybe you've seen the higher percentage of tests are really high, but just 2% are tested positive. So we're testing a large number of people. So this is for the tests. thank God, the capacity for the isolation, treatment, and quarantine are sufficient. And we emphasize and remind ourselves always with the current number and the great efforts exerted, we assure everyone that we're doing our best, but we ask for everyone to follow the instructions and the guidelines issued by the relevant authorities. As for the capacity for the isolation and treatment centers, we have stands at 1,699, of which 345 beds. As for the private capacity is 172, of which 4 are used. As for the quarantine centers, the capacity stands at 2,504, of which 947 used. And for the private sector, capacity is 321, of which 94 beds are occupied. So we're going forward, and we have to be careful, as I remind everyone, and we emphasize on following the instructions and guidelines for citizens, residents, and the business owners. As you have seen, there are some measures. The normal life in Bahrain is continuous. It didn't stop. Yes. There are some shops have some decisions, but we have allowed mostly for people to open, and with strict decisions on certain measures like wearing masks. And also we take it into a smart way, and to be precautious as much as, and we wish that everyone would collaborate with us. The relevant authorities are always providing the sufficient number of equipment, face masks, whether made outside or inside Bahrain, and we ask everyone to use them and wear them. Even those homemade ones, they would essentially protect people, protect them and protect the others. So this is the benefit of wearing masks. At the end, I'd like to express my thanks for all the supporters for the national efforts in order to safeguard the health of everyone, led by His Royal Highness Prince Salman bin Hamad Al Khalifa, the Crown Prince, and what have been announced campaign led by His Highness Sheikh Nasser bin Hamad Al Khalifa, and in line with the current efforts, we are really into the right path, and hopefully God would protect our kingdom. And I'll leave the floor now to my dear brother, Dr. Manaf Al-Qahtani. The floor is yours. Dr. Manaf Al-Qahtani, infectious disease consultant at the BDF Hospital, member of the National Taskforce for combating coronavirus. Thank you very much, Dr. Walid Al-Mani'. Your efforts are great. In the name of God, most gracious, most merciful. Good evening to everyone. I'm very glad to be with you today. As usual, I have certain points on 3 pillars. Number 1, the first pillar, I'm going to talk about the efforts of the National Taskforce and collaborating with all the authorities and bodies to combat coronavirus. The second point is about the results of the precautionary efforts when conducting the tests for the expats labors. The third point, or the third phase, is about developing the current protocol that we're going to start in the coming days in line with the developments related to coronavirus, COVID-19. First, I'd like to begin by what Dr. Walid Al-Mana mentioned. We highly appreciate all what has been mentioned in the speech of His Majesty, King of the Kingdom of Bahrain, of instructions and the appreciations of the National Taskforce for combating coronavirus. And I would like to emphasize that the national efforts of this task force are really continuous and the main objective is to safeguard the health and safety of all residents and citizens in the Kingdom of Bahrain. The first point, the efforts of the national team that are following up with the updates and developments to combat coronavirus. I think everyone have heard about the news that there is something we are really proud of, as I am part of the military, that to build the intensive care unit in the BDF that contains 130 beds within a period not exceeding 7 days. And this is really of pride to the Kingdom of Bahrain. The importance of this, it is one of the precautionary steps that we always emphasize on. And we praise and we ask God that we don't use it, but we are just totally ready to face any emergencies. And so this intensive care unit has been built in line with the highest standards and have been prepared by a Bahraini team from the BDF. All of these are going into one objective to safeguard and protect the health and safety of the citizens and residents. And also among the news, and it has a nice name, Swap and Go, you know. So this service we have built that you are just in your car. It is available at the International Exhibition and Convention Center. It is for the comfort of the citizens and residents. So you are just being tested while you're in your car. As you can go, we have 8 stations. We have conducted now over 600 tests in one day as a trial. And we have a capacity to 600 and 800. And the second point that everyone is talking about now, and we would like to, and it was emphasized by Dr. Walid Al-Mana. What are the results of this precautious measures, and what is the reason of this increase? I think we've mentioned at the press conference, the previous press conference, that we might have certain increase, and this is as a result of the precautionary measures. If you would like to know among the main reasons, and that we always emphasize on throughout the press conferences, is because they gather in their dormitories, and we would like to emphasize again, among the safest steps is social distancing, the safe zone that we always emphasize on. So among also the pieces of advice we repeat, and I'd like to repeat and note for everyone that we train everyone, and you would hear it over and over, which is as follows. The hygiene of the hands, it is one of the steps that we should get used to, whether during the age of Corona or during the other normal days. We need to wash our hands regularly. It would protect us Also, the surfaces, we have said that the viruses going onto the surfaces, so it is important to disinfect these surfaces. If we have buildings and premises where they have people, we have to deal with these surfaces by disinfecting them and cleaning them. And one of the etiquettes as well that we would like to follow even after Corona is how to use the appropriate way of coughing. There is a certain etiquette to reduce, by closing the mouth and nose. And it is one of the methods of stopping the viruses of any type from going out. So we have to teach our kids how to do the appropriate way of stopping the coughing and sneezing. And tissues also, they have to be thrown into the trash. If there is a person who's sick with any respiratory symptoms of corona or any other types, as a patient, you have to isolate yourself. You should not mingle with the others. The importance of masks, we repeated that in previous conferences. The importance of masks is for everyone because they stop the outbreak of the virus in the community. If you are outside, it is preferable that you wear the mask. Many studies prove that. The slide at the back would show the risk levels, even if you don't have symptoms, but you have the virus while sneezing or while coughing, while breathing in and out. Without the mask, it could lead to some of the droplets would be there on the surface, and so that's why we emphasize on cleaning the surfaces and we emphasize on washing the hands. These are among the important steps of stopping the virus. Now the question, what is our current capacity for testing? Now we are in the 7th week. I think from the first week we had like 900, around 900 tests. Now we are 11 times double, and now over 3,000 tests on a daily basis. And that proves the readiness, the great readiness of the Kingdom of Bahrain while going to the 8th week. And we have the capacity to increase the tests. That shows the capacity and readiness of the Kingdom of Bahrain. As for the current active cases, we've mentioned the number is just a number, but it shows you the readiness of us. So the active cases now, 751. We have only 80%. We have a stable. So some of them, they don't have symptoms, but they could have the symptoms. Now, the third point that is really among the plans that we develop is to develop the protocol, the treatment protocol. So we have reached the level of using what is called the convalescent plasma. So following the directives of His Excellency Lieutenant Colonel General Dr. Sheikh Mohammed bin Abdullah Al Khalifa, and with the coordination of Sheikh Rashid bin Al Khalifa, to use the convalescent plasma is to use the antibodies into the recovered people. We have a large number of those people recovered, and this is a bless from God. We're going to use the antibodies in their bodies according to the scientific trials and experiences, and we have other countries trying to use and implement this way. So we have seen it appropriate, since we have a large number of recovered people, to use the antibodies in their bodies and use them for the patients. And so we're going to implement this within the coming few days, and would like to emphasize that this is one of the clinical trials approved by the medical team. We're going to conduct it over 20 cases in accordance with the bases and standards that we have built in the Kingdom of Bahrain. Before I conclude, I would like to emphasize onto the 3 points that I just mentioned. First, I highly appreciate the efforts of the national team, and we emphasize that we're going on to safeguard the health and safety of residents and citizens. We're going to develop and update all the procedures in line with the updates and developments to combat coronavirus. And the last point is to focus on our goal. We're all together to fight coronavirus. And to conclude, I'd like to leave the floor to my colleague, Dr. Jamila Salman. Thank you very much, Dr. Manaf. In the name of God, most gracious, most merciful, good evening to everyone. At the beginning, I'd like to highly appreciate what has been mentioned by His Majesty King Hamad bin Isa Al Khalifa, King of the Kingdom of Bahrain, in his speech when he praised the medical team in the Kingdom of Bahrain, who are working 24 hours to safeguard the community. So this mentioning is of great pride to us. And this is in line with all the relevant authorities working with us. And this pushes us to the next phase of treatment. We emphasize on the precautionary steps, not just up to current. We're going to increase it, and we're going to intensify it, including the tests that we're conducting, for which that we have seen an increase in the active cases from the expat laborers. Just to give you a brief, we have the numbers available on the website of the Ministry of Health. We have active cases 751, 747 stable, and we have really 4 critical cases, and they are followed by specialized medical team for 24 hours in line with the standards provided the Kingdom of Bahrain that are competitive around the world. And we are on ongoing follow-up with other countries to exchange experiences and change the protocols in line with the updates. As I've mentioned before, it is a novel virus, and on a daily basis there is like 4 to 10 scientific research issued, so that they have impact on changing and developing the protocols. The total number of those people getting out of the recovered, 600, around 600, and we're following up with them after they leave the quarantine and isolation, just to ensure that they have 0 virus. And this is built on the experiences of the other countries, because there are few cases where this virus could continue even if they leave. And out of this, we emphasize, like all these patients, they have quarantine, home quarantine, and we follow up with them regularly. As for the most important point, the results of the precautionary testings, and we have seen an increase in the number of the active cases, as mentioned by Dr. Walid Al-Mana and Dr. Manaf. This was expected for simple reasons, but important, which is gathering. This is like the theory discussed by everyone. The social distancing is really important. So if you gather, the main reason was because they were gathering in their dormitories. And this is not just limited to expat laborers. This has been mentioned into many campaigns. Social distancing is important, so we shall really strictly follow this for the coming weeks so we can really get the results and the positive results. Other reasons and have been mentioned as well, and I would like to emphasize that they are really, really important, and because we're talking about science, we have to protect ourselves. Protection is more important than treatment. So in order to decrease the number of the cases, and we have good results. So I would like to emphasize and repeat what has been mentioned by Dr. Manaf, to regularly wash hands. We have to really keep this in mind, to clean and disinfect the surfaces. If we repeatedly touch them, whether at home or at work, the etiquette, if we say like the way we close our mouth and nose when coughing or sneezing, and if we see people with symptoms of flu or fever, we have to stay away from them. And if there are any symptoms, they should call 444, and they will be given the certain instructions on how to deal with that. Also important, very important, wearing masks. There are different types for the medical side and the other mask, normal masks for the society and community, because we're protecting ourselves and we are protecting the others communicating with us. So if everyone is just following these simple instructions, then God will have great results, and they will be added to the achievements of the Kingdom of Bahrain, not just at the regional level, but international levels. And at the end, I'd like to emphasize what has been mentioned by my colleagues. We will not reach that level of reducing the outbreak without the efforts of everyone. Each individual, whether from the medical side, from the government entities, non-government entities, those dealing with people at home, citizens and residents, we all have to be one hand, because if we have any issue, it would affect the whole system of combating this virus. And this is proved by all the organizations, by the whole world, and hopefully God will protect everyone. Thank you very much, the speakers, for your briefs, and now we'll take the questions who are following us remotely. Now we start with question from Fatima Ali from Akhbar al-Khalij newspaper. To Dr. Walid, will the delivery laborers be tested because we can identify them easily? And also, what about the laborers moving from one place to another, like washing cars or cleaning houses, and they have providing competitive prices? Thank you for the question. Well, for the testing, we have certain methodology to cover the whole labor in general. We are continuing these tests, and we keep in mind that they should not transfer to others. We have conducted tests for delivery laborers, and in the future will cover even residents and citizens. Will take precautionary steps in order to have great results in terms of doing precautionary measures. Rachel Ibrahimi to Dr. Manaf from Bana. to what extent these homemade masks will be effective. Are there any medical conditions have to be followed? Yes, medical conditions are before wearing masks or before removing it, you have to wash hands. These among the things people should follow. The masks, we've used them for all. The objective is to stop the spread of the droplets. So we're not talking about the medical mask. We're talking about any piece of cloth that could cover the nose and mouth, because we are in a pandemic level. So in any pandemic, it is preferable to close noses. So we have to follow the recommendations of the international organizations. They recommend to close the nose and mouth either by masks or just homemade masks or a piece of cloth. They would do fine. Another question to Dr. Jamila from Sofraj, from Star Vision News. With the increase in COVID-19 cases, does Bahrain have the facilities enough to deal with all the patients? It is a very important question. And Dr. Walid mentioned the capacity in Bahrain, whether for positive cases as patients or even those cases which require only quarantine. The capacity in Bahrain is great. We have done that in a precautionary manner, and the occupancy is less than 50%. So yes, we have the readiness to deal with more numbers, but we hope that we don't need that in the coming weeks. Another question from Naila Barakat from Bahrain News Agency to Dr. Walid Al-Mana. Will schools be open in the next semester? How would we ensure the disinfection for all public schools used now for expat laborers? Although the nature of the virus is new and it is a novel virus, so we don't know. We're still dealing with this virus. The first part, we can get you details for when to open the schools. As for the current medical situation, hopefully once the situation is safe for everyone, and we hope that next year will be normal for schools and others, and students can go back to school. We hope that we can go normal, but the question for the second part, I'm not sure how to use the schools. They're not used for as places, but the schools are disinfected after being used. Just to clarify to people, even at work, there could be a one case. So that, like for example, another example for airplane, cars, there could have an infected person. So that's possible for any place. And there are certain ways of disinfecting the places. Some places, they are open. Yes, so classrooms, any places used before by infected people, they'll be disinfected. So people might feel a bit sensitive of using like hospitals, of cars, These could be normal. Question from Ayman Shekl from Al Watan newspaper to Dr. Jamila. How do we ensure the safety of everyone from the laborers, like those that are using gas stations? So what is the advice for people? For the advice, if we want to protect ourselves, not from laborers, from anyone who would be infected at any time. And this is based on the basics. The social distancing is really important. Even if we go to open places, areas, we need, if you go like shopping, there are certain mechanisms. There is like 1 meter distance. They have to be, there has to be a person to calculate people, to disinfect and sanitize their hands. The use of masks would help a lot in protecting people. The question is always there. What if I purchase something? Do I need to? Yes, you can disinfect any item you purchase from outside. In addition to the etiquette of using your hands to close your nose and mouth while coughing and sneezing, and also to throw the tissues in the trash. So if we use these appropriately, we can say that this would decrease the outbreak of this virus. Question from Kumar to Dr. Manaf. There are cases in labor dormitories. What are the steps to be taken, and will there be any curfew? The first part, if we test a labor in certain place, they will be addressed like any other case. They will be isolated, and based on the nature, if they need treatment, we will have them treated. And then this could lead to the next step, the contact tracing, that we would trace the contacts and isolate them, the close contacts, and we would follow the known protocol. So whether laborers or any other individuals, they are addressed equally. The second part that I always asked, and this is like for the curfew, I say at this current stage, we don't need curfew, but the ban of the gathering is effective. As for curfew, it all depends on the updates of the coronavirus. So we'll leave this curfew until the time that, God forbid, that we might need it. But at the current situation, we don't need it. Question from Tamam Busafi to Dr. Wali. You said you don't need curfew, but just social distancing to ensure the normal life. But the cases we have into laborers, due to the nature of their work and their jobs, they can't be done remotely. So don't we need a curfew or isolation of these places? No, it is the opposite, as I mentioned. The cases is because they are gathering in their dormitories and buildings. So that doesn't, the curfew would not stop the spread, because if you implement the curfew, they would still gather in their dormitories and their places. So the steps that we have taken to maintain the social distancing is among the most important steps that we can implement, not only for citizens, also for the expats, to keep in mind the social distancing, maintain the personal hygiene, and it is a message that I would like to deliver. I don't want to relate the virus to a certain citizenship, to a certain race. No. If there are any reasons, before becoming Muslims, we need to help everyone. We need to help the laborers. We need to maintain their safety because they are here to build our society. We need them. They need us. So I think it is our role now to spread awareness among them, to provide the appropriate dormitories and places for them. We look for the reasons and causes. Yes, the expat labor among the top priorities until the time that comes to test them and trace the precautionary measures. So I would like to emphasize it has nothing to do with certain laborers or certain race. No, but the reason was because they were populated and gathering in one single place. Just in addition to what has been mentioned by Dr. Manaf, the curfew is more strict, and I think it is important, but looking into the current situation is more important. So to ban gathering is more effective. We have to keep in mind the procedures. Maybe the implementation of curfew is not in the right time now. There are many tools and equipment that were used not in the right way. So they have to be, whether curfew or ban of gathering. So there are many precautionary steps and measures that are issued based on the situation. A question to Dr. Walid from Jamal Yaqut what is the extent of cooperation between the Kingdom of Saudi Arabia and Kingdom of Bahrain in terms of combating this virus? I emphasize always the close relationship between both countries and citizens. And so each citizens in the other country are treated equally in terms of being tested and provided with the appropriate equipment and treatment. I think both countries, we are sharing many matters. They are brothers and sisters. Hopefully we're going into the right path. Ghazil Ghariri, Dubai TV channel, to Dr. Manaf. Will the cars be tested? As for the mobile units, will these reach each neighborhood in Bahrain? It is available for all citizens for free. They drive through. As for the mobile units, they're available and they are going into all different areas in Bahrain into a certain mechanism. We thank them for that. And we are expanding the tests. So we have unified or one single station at the exhibition center, and also the drive-through, and also the mobile units that we're doing. So each one has its own mechanism, and thank God everything is going smoothly, and it was of great results. Thank you very much, the speakers, for your briefs and answering the questions. And thank you, ladies and gentlemen. Before we conclude, we would like to note to follow all the precautionary measures and instructions to combat coronavirus. Thank you very much for watching and listening.